Okay, I think we should get started today. Hello and welcome everybody to our webinar this afternoon. I'm Megan Dotson, Program Manager for the National American Indian and Alaska Native Mental Health TTC. And today we have Talor Gray presenting the Introduction to Peer Support in the Era of COVID-19. This series is brought to you by the National American Indian and Alaska Native Mental Health Technology Transfer Center. And as you can see on this, we are part of 10 regional centers, and then we have a network coordinating office and a National Hispanic and Latino MHTTC. This project is supported by the Substance Abuse and Mental Health Services Administration. The content is developed by the presenter, and the opinion expressed does not necessarily reflect the views or policies of SAMHSA, HHS, or the American Indian and Alaska Native MHTTC. So we had a couple questions on this earlier. CEUs are available upon request for a $15 annual fee. And in the next couple of days, we'll send out a follow-up email to everyone who attended, which includes a link to the recording, the handouts of the slides, and a CEU request form. Our center is an NADAC certified educational provider, and we'd be happy to provide you with CEUs. We charge a $15 one-time annual fee for an unlimited number of webinars that you'd like to attend. So if anyone has questions about that, please email us. Immediately following today's webinar, you'll be redirected to our GPRA evaluation, and this survey just takes a few minutes to complete and asks about your satisfaction with this event. This feedback is critical to our future work, and we value your opinion and would greatly appreciate your time and sharing your thoughts with us, if you wouldn't mind. So you'll be muted for the duration of the webinar, but please use the chat pod to share your questions and comments, and we will address questions at appropriate points during the presentation or at the end. Today, Talor Gray, we're excited to have her presenting for us. She's a graduate of the MPH program in the Department of Community and Behavioral Health at the University of Iowa, and is a certified NAMI provider and in our own voice speaker, and has provided trainings in population for mental health, disability, sensitivity, and building self-advocacy skill sets. She currently works at Olmsted County Public Health in Rochester, Minnesota as a community health specialist focused on mental health and substance use topics. Thank you so much, Talor, for your work in this field and for sharing your experience with us today. And at this time, I would love to pass it over to you, and I appreciate your time being here today, Talor.
Yeah, thank you so much. Can you hear me all right?
We can.
Okay, perfect. Well, yeah, hi everyone. Thanks for listening in today. I'm really excited to be here, and I want to thank the National American Indian and Alaska Native Mental Health Technology Transfer Center team for inviting me on to speak today. I also want to thank all of you essential workers and service providers out there making a difference every day. Truly, thank you. Thank you so much for all of your work. I know going through a lot. There's a lot happening. So with that, today I hope I can share some useful insights into the field of peer support and some information about COVID-19 implications along the way. So because I'll be doing my best to stick to that 1 hour time limit, you'll notice that I've included some links throughout this presentation to additional materials that you might find helpful. So like publicly available toolkits and guidelines. I'll be doing my best to point out major resources as we go, but since the slides are available as downloads, you should be able to check back if you want to explore more of those links. And as Megan and Kate had mentioned, feel free to type in questions as we go along. I'll do my best to answer as we go, but also mainly we'll have time at the end, the plan, to answer additional questions. So excited to get going here. And so with that, let's see here, whoops. use the arrows. Thank you again for the wonderful introduction. Yeah, you know my kind of background now, and I saw earlier in the comments that there's a question about what NAMI stood for. It is National Alliance on Mental Illness, so that is what that acronym is. So for today, I plan on covering the basics of the peer support field, along with what peer support program development looks like. Of course, COVID-19 has created a lot of changes for all of us the past few months, so I want to make sure to address a few of the implications to peer support as well. Okay, so what exactly is peer support? There are many different definitions out there, right, for peer support, but I thought this one by SAMHSA summarized it nicely. It states, peer support workers are people who have been successful in the recovery process, who help others experiencing similar situations. Through shared understanding, respect, and mutual empowerment, peer support workers help people to become and stay engaged in the recovery process and reduce the likelihood of relapse. Peer support services can effectively extend the reach of treatment beyond the clinical setting into everyday environments of those seeking a successful, sustained recovery process. So that's a pretty encompassing definition, but I do want to also make clear that peer support workers or specialists do work outside of the mental health and substance use field as well, such as working with people managing various health conditions like diabetes, for instance. Peer support is not a new concept by any means, but the professionalized field is kind of fairly new. So tracking the history of the peer support field can be a little tricky, since technically various forms of peer support have been around for centuries and are usually connected to cultural and spiritual practices. Though these practices aren't always identified in the clinical literature, though. Peer support and recovery techniques have played a large part in Native American culture and are still very much alive today, exemplifying that resiliency of American Indian nations and the value of holistic wellness. So historically, the clinical idea of peer support is often described as beginning around 18th century France, along with the moral treatment era and the work of Philippe Pinel and Jean-Baptiste Poussin. So both are prominent figures in the humanization of people living with mental illness at the time. Peer support in the US was used intermittently between then and the deinstitutionalization movement of the 60s, and it wasn't until it resurfaced largely with the consumer survivor ex-patient movement in the 70s that history saw it grow to gain traction in the 80s and 90s with the movement's integration with healthcare services. And it wasn't until 2007 that peer support services became a Medicaid-funded service. And the field does continue to grow today in integrated healthcare and community-based settings. So what is the big deal around peer support? What sets it apart from other services? The short answer to these questions is the recognition of how important a person's personal experience can be and the power of transforming often painful personal experiences into stories of success that can help support others who may benefit from it. The use of personal experience in the professional setting sounds slightly contradictory, but it is an essential part of peer support, and there are many reasons for this. The experience of living with a mental illness or substance use disorder is often difficult to verbalize, and people may be hesitant to share their story for fear of stigma and discrimination. Supporting the safe sharing of stories helps others to realize they are not alone and their story is important. Advocacy from a place of understanding and representation is essential to moving forward needed policies and legislation. The saying, "nothing about us without us," was popularly used in the US during the disability rights movement. Though the saying wasn't founded here in the US, it has been used in variations throughout history to drive home the importance of representation in policy and decision making. So using personal stories at the political level helps to build representation and ensure voices are heard. Also, addressing stigma and discrimination through sharing personal stories can build a culture of acceptance. When we share personal stories, we open up to others and create an environment for future sharing. Usually one shared story can lead to another, and really pretty soon you have a room full of people waiting their turn to share their experience. It's a very humbling kind of experience to be a part of that. For many people, they may have never thought about or had the opportunity to share before, and this is their first time opening up to others. Some people may not have their own story to tell, but may have questions that they've been wanting to ask and have just never had a chance to ask someone. Others may not want to share or aren't ready to share their experience, and that's entirely okay too. The acceptance of sharing and asking questions can vary greatly across communities. So intentionally building a place of acceptance for mental health and substance use recovery through storytelling can lead to further addressing potential stigma in and around communities. Finally, storytelling can be a culturally inherent tradition, and it's important to respect those practices. Stories tie us together and support empathetic relationships, but they also teach us new skills and ways of living. We share stories every day, even without really thinking about it. So it's important to remind ourselves occasionally that each story is unique and holds purpose. There actually are entire trainings on learning to share your mental health or substance use recovery story. It really is important to learn how, when, why, and where to tell your story or parts of it if you want to use your story to support others safely. Many people find healing and support in learning to use their stories to help others. This is actually one of the reasons I found myself drawn to mental health advocacy organizations about 10 years ago, to learn how to turn my own story into something that I see as a strength and a driver to continue doing the work that I'm passionate about. So recognizing that every person has a unique and important story just puts us all one step closer to a more empathetic society where we can truly work towards addressing issues like stigma and inequity. And one way that we can do that is through peer support. So what exactly happens in peer support? I want to start this section by saying peer support and peer recovery may look different across different programs, agencies, countries, and cultures. What I'm sharing today is what I have grown to become familiar with, but this does not mean it's the only way to provide peer support services. Peer services are meant to be built out of personal and community need, which makes this field so flexible. So with that said, let's start with emotional support, which really is the basis for peer support, along with active listening. So peer support is not a service specifically focused on providing treatment, right? Its purpose is to provide support during a person's recovery journey and walking alongside them in their experience. Peer support specialists are normally not professionally trained in treatment practices themselves, but they do often receive training to appropriately work with people with the various types of mental health and substance use disorders through supportive techniques. Similarly, peer specialists are trained to establish professional boundaries for the supportive relationship. This can be tricky at times, especially with community-based peer services where peers may see each other in the community often, but ethical and confidentiality guidelines are present in the peer support field, just as with other mainstream health professions. One way to both maintain boundaries and establish a working relationship is through goal creation. So goal setting is essential to not only direct the peer relationship, but also to give people a way to measure their progress in their journey. We don't usually think to keep track of how far we've grown in adversity. Usually we're too busy trying to cope with the present to think about what we want for the future, right? I've sat down many times with people to work through goals, and something that has consistently stood out is that many people have never really thought before about what they want for their future and how they want to achieve it. That doesn't mean this information isn't important or hasn't been asked by their families or treatment teams. And I do want to mention that there is a growing push for person-centered care to address this. One of the major reasons given for why I've come across this situation so often has been because the person doesn't believe in their ability to make decisions for themselves. Maybe they haven't been asked these questions before. Maybe they've delegated another person to make those decisions for them. Maybe they've been too overwhelmed to even think about setting goals for the future until that point. Creating a goal can be very emotional for people and takes time. It's important for people to know that the goals that they choose must be their own, but they don't have to be unchanging, right? So let's talk briefly through the art of setting practical goals. I like to use SMART goals or a variation of that method when working on goal setting. If you haven't heard of SMART goals before, it stands for specific, measurable, attainable, relevant, and time-based. Along with creating the goal itself, you also want to work with a person on action steps to reaching the goal. Like who is responsible for what tasks, are there any resources needed, or what barriers can be identified starting out. Goals don't always need to be achieved to have a positive effect on a person, too. Sometimes just having a goal to work towards can be enough to give someone hope. And there are valuable lessons to learn from both succeeding and having to walk away from a goal. This is one of those moments where I have to use the cliche that the journey is more important, or it's often more important than the destination. So creating a solid, feasible goal is a major step in supporting someone in their personal growth and developing self-determination skills. Education and skills building are next on this list and really goes along well with goal setting. If someone's goal is to learn a new skill, maybe how to use the bus, right? That's something that a peer support specialist can help with. Depending on if the peer specialist is able to meet in the community or not, they could potentially practice going to the bus stop, buying tickets, or even taking the bus with the person. Peer support programs vary quite a bit, but if the program is flexible enough, peer specialists can provide supportive services like this that usually aren't possible in other treatment settings. Also, with our shortage of mental health professionals, especially in rural areas, having peer support available and accessible can help fill in some of the gaps in the field today. So next we have systems navigation, which often goes hand in hand with peer support, especially when working to address barriers to wellness or accomplishing those goals. If someone's goal is to learn how to be financially independent, for example, peer specialists may work with a person to address barriers that may come along with that. So maybe that includes supporting someone in navigating financial assistance applications or other public benefits the person may qualify for. Often peer specialists have been through similar situations and may already have personal experience navigating systems like Medicaid or SNAP. This doesn't mean peer specialists will be able to solve every barrier, right? And really needs to be a combined effort between the person and the peer specialist. This is supposed to be a voluntary program of working together. But overall, it does mean that person knows they have an advocate in their corner willing to support them. That alone can be immensely meaningful to a person. So navigating Social Security, disability application process, and work incentives actually became specialties of mine. I also helped quite a bit with private and public health insurance advocacy. I had to learn these systems because these were the systems people were struggling with the most at the time. Depending on the community, you may find themes pop up around what people are needing. Because of this, peer specialists are really great resources if you want to know what major community needs are present. So learning about community needs and barriers to wellness puts you exactly where you want to be if you want to advocate for community or policy change. There really is no better way to understand a barrier than going through it yourself. And when that's not the case, right, working to help others to overcome those barriers helps too. If you haven't been through the process of applying for Medicaid, housing assistance, or or even those Social Security applications, I highly recommend you look up some of the directions and forms to get a glimpse of what people are up against daily. And that's just the paperwork side of it, right? Depending on the program, peer support specialists can advocate for people in situations that may be difficult or unfair. So for example, if someone is having trouble with filing for food assistance because they don't understand the paperwork, a peer specialist might be able to support the person in requesting additional support or reasonable accommodations. It's possible too that there may be situations where advocacy is requested, but more for supportive reasons, like working with someone to learn how to advocate for their own needs at the doctor's office. There are plenty of examples I could go through of what peer support looks like, but really it's safe to say you learn to wear a lot of hats and you get real creative. So moving on to the impact of peer support, I think it's important to recognize that while peer support is talked about mostly in terms of mental health and substance use recovery, we need to keep overall wellness in mind. I used to use this chart by Swarbrick when working with people to talk about goals and how they wanted to work together through peer support. When working with people, a peer specialist could be talking about any one of these areas in this diagram. And really part of being in the peer support field is knowing that overall wellness is essential to health. So to be a peer support specialist, you must be maintaining your own recovery and able to share what has helped you in achieving that, whether it be through coping strategies, healthy behaviors, spiritual practices, or something else. Being able to recognize and share with others what has helped can be immensely meaningful. This doesn't mean that people need to take these suggestions, because we all know that each person is different and something that works for one person may not work for another, right? So what this does mean, and what makes this a unique opportunity, is that to share healthy coping strategies, right, is that it's coming from someone who has walked in similar shoes, and since a peer's job is not to treat the person per se, this sharing of knowledge is meant to be low pressure. So, or rather, people can take it or leave it if they want. Let's see. Oh, I see a comment about peers not being allowed to work with paperwork. That is, yes, that is common. There are times when, depending on the program, you may not be able to, just for different policy reasons or things like that, that may not be a part of the job. Different programs are, they're treated differently. They have different kind of regulations and guidelines and things like that. So thank you for pointing that out. That paperwork may not always be a part of that. So let's see here. When working with peers, I did often find that the fact that I wasn't working as a medical professional or providing support as a family member gave me a different angle when working with people to share healthy strategies. And there seemed to be less of a perceived risk of people feeling guilty if those strategies weren't practiced, like we had talked about in our last meeting. As a lover of all things public health, I did find this to be a great avenue for public health education programming. And this is a great way to better understand and influence social norms if we're talking about health behavior theory. Now, the opportunity to connect on a cultural level is really a very important facet of peer support that deserves more attention. So peer support can not only be about the mutual understanding of health experiences, but also cultural identity. There are times when people may feel more comfortable working with a peer specialist who understands and also practices their cultural traditions. And that goes to show the need for cultural inclusion and appropriateness in peer programming. So for cultures where historical and intergenerational trauma is present, people may prefer to work with someone who either has been there themselves or is able to provide culturally appropriate support. Cultural practices and traditions can be a major aspect of wellness for people and a supportive factor in recovery, and that really needs to be respected. Often we find that reconnection with a community's cultural practices can enhance feelings of social connectedness and inclusion. The flexibility of peer support services make it possible to adopt different supportive practices that may be difficult in other healthcare settings or practices, like the recognition and inclusion of nature in the recovery process. Though I will say, there has been an interesting recent push for the concept of nature prescriptions in healthcare that's been exciting to watch grow. Diversity in peer support is essential to providing equitable services and fostering an environment based in inclusion and the recognition of different experiences. So moving on to self-stigma and isolation, it's important to understand how these two concepts interact. We know that mental health and substance use stigma is present in our society, and we're doing what we can as professionals and advocates to address that. But what we also need to address is the self-stigma that happens internally for people. Self-stigma itself can be very isolating, stemming from fears like I'm not good enough or I don't deserve help. Peer specialists are in a position to say that they've had those same thoughts, been through that fear and isolation, but learned that those fears are not true. It takes time to overcome self-stigma, and sometimes we may think we're past it and then fears start to bubble up again. So having a supportive peer support team around that can remind people that they're not alone in that internal conflict and can buffer the negative self-talk and build a bridge of communication for when isolation may start to set in. So again, peer support is not about treatment itself, right? It's about support through recovery. And part of that support is making sure others don't feel alone. Peer support is often talked about as happening after treatment has begun, but more often than not, I've seen peer support become a pathway for people towards treatment. Many peer support programs work with populations that can be difficult or to reach. And don't always have access to treatment or just may not know how to start the process. So by building a trusting and low-risk peer relationship, peer support staff can connect people to not only treatment options, but other essential services that they may be needing as well. Help-seeking behaviors can be forged this way too by sharing steps to navigate community resources. Treatment adherence and self-determination are two different ways of experiencing treatment, and that's kind of important to identify. So treatment adherence, that word adherence can sometimes have a negative connotation for some people working towards recovery, especially because of the stigma around mental health and substance use. On the other hand, self-determination in treatment is about learning to take an active role in recovery decision-making. Now, this doesn't mean saying yes or no to everything. It means actively engaging their recovery team and learning about the options available through open dialogue and honest interest. So while these are two different concepts, they can be used in combination. Peer specialists can play a role in this by providing self-advocacy skill building, role-playing, and potentially acting as a peer advocate at medical appointments. Overall, peer support programs have seen growing literature around their ability to support recovery. So stronger recovery outcomes, lowered rates of rehospitalization, and increased recovery maintenance are a few areas of peer support influence that have received attention. So we've talked quite a bit about what peer support is and what it can do. So now let's take a look at what it takes to get a program going. Keep in mind that each peer program looks a little different, and we may see additional variations with the current COVID-19 crisis. So first, let's talk about what you have to do to become a peer support specialist, right? Having a lived experience is obviously a major requirement. though there are opportunities for family members or loved ones of someone with a lived experience to work as a family peer support specialist. Depending on the agency, state, or tribal health guidelines, you must be able to complete the required training and certification, though these can be dependent on if services will be billed to Medicaid or other health insurance options or not. If you plan on services being billed to Medicaid or other health insurers, training and certification is most likely going to be required. Also, certification often requires the accumulation of certified hours or supervised and certified hours and completing a formal test. So keep this in mind, though there may be some leeway on this right now with the need for more service providers to support the COVID-19 response. You also will need to meet the agency requirements for employment or volunteering. Now, these requirements can vary greatly, of course, depending on the situation, the agency. An example of this may be working as a peer support specialist among incarcerated populations, right? Let's see. Now, there is the difference between formal and informal peer support that I want to highlight. Formal peer support, per se, will have structure and training for peers, while informal peer support can happen without either, really. Peer support happens in our daily lives, right? But there are additional trainings, there are guidelines and things like that we can learn and we can follow if we want. So peer support training and certification opportunities are not always easily available. Many programs are held in person over multiple days, requiring people to travel and stay overnight. And then there's often a training fee associated, though there are grants and training reimbursements that are sometimes offered to support the growth of the field. So I remember when I went through peer support training, I had to travel about 3 hours, or maybe it was 2 hours out, and stay for about a week to work through or to go through the training. So work does still need to be done to make trainings more accessible, and we'll get there. I mean, we just need more of that push, right, and growth to the field. If you're curious about what your state requires, or what your region requires, and what training options are available, Copeland Center does have an interesting database at the link below, and that kind of gives you a base understanding of what might be available or going on in your area. Also, there are some digital quick course trainings out there for COVID-19 response that may be of interest to some out there, and I think I have a link to that later on in the slides. So at the heart of any peer support program, you have core competencies that direct services. These often mirror SAMHSA's, which includes recovery-oriented, person-centered, voluntary engagement, relationship-focused, and trauma-informed competencies. Now, each of these competencies should be kept in mind when building and evaluating peer programming. So on the left of this next slide, I have listed three different public toolkits for peer support program development that I came across while preparing for this presentation. If you're interested in learning or exploring what's out there already, now most of the time you can break down the peer support development process into 6 major considerations. Before you get too far ahead of the game, please make sure you're checking with the agency or community you'll be working with to learn what the interest and need is for peer support. Many of us in community services know that just because you build it doesn't mean people will for sure come, right? So make sure there is interest in the service, or get that community communication started. Now, mapping out plans for program development and evaluation is next. It's good to include timelines and how you will measure service use. Please keep process evaluation in mind from the very beginning. Right? You don't want to get 6 months down the road and realize something isn't working that you could have worked on and changed around 5 months ago, right? Also, tracking the process of program development lets you revisit your work if you want to replicate the program in the future. Makes it a whole lot easier to keep if you're keeping track of all of that. Determine if and how services will be integrated. How do you want peer services to interact with the services you already provide or that are already going on in the community? So talk through what this could look like. Get some brainstorming going there. And on a similar note, prepare for an agency culture shift. This one can be a little bit surprising at times. But if the change in service delivery is not discussed with staff, there could be some stepped on toes, right? For a while anyways, which honestly could make for a bumpy start to a new peer support service launch if you have multiple types of services going on at the same time. Involve staff in the program development process as much as possible, and that should help to alleviate some of this and build agency cohesion around the initiative. Establish peer roles and responsibilities, so as well as clear supervisory support. Peer support is still a fairly new field, so it's understandable that there may be some gray areas for a while before figuring out a flow to services. I would suggest reaching out to other peer support agencies that may be able to provide examples of what has worked for them and maybe what needed improvement along the way. Finally, make sure to provide appropriate opportunities for peer support training, mentorship, and community network building. It takes time. It takes lots of time to build these programs, and so definitely, as it's growing, be gentle with yourself and the agency. This is a gentle process, right? So next, you'll want to think about structure. Peer programs come in many shapes and sizes, and each has their own niche. I've listed out 4 categories here that I felt provided a pretty good range. But this is not all encompassing, right? Starting out, individual peer support services are based on one-on-one interactions between the peer specialist and the person in recovery. And similar to therapeutic practices, it's common for the relationship to remain consistent with the person in recovery meeting with the same peer specialist for services. Now, organization-based groups are facilitated by an employed or volunteer peer support specialist through the organization or agency directing those services. Most likely, the facilitator is a formal peer support specialist, and while it's helpful for the facilitator to remain consistent, it's not always required since peer support in this case is largely provided among the group of members themselves, right? Now, community-based groups, on the other hand, may have received training from an organization's peer support specialist, or they may have started out with a formal peer specialist leading the group or facilitating. but groups in this case are often meant to become fully sustainable on their own. The designated facilitator in that regard may end up being an informal peer supporter. So finally, family-oriented groups are similar to the groups stated above, only these groups serve family members of persons working towards recovery. Family peer support specialists most often lead these groups and can either be formal or informal. So other things you may want to think about when talking about group structure is the group size, communication, method, location of meetings, and who will be the facilitator. Also, it's very common for peer group rules to be created and agreed upon by all involved at the creation of groups and revisited whenever necessary. So honestly, a great example of effective peer group guidelines can be found really in the practice of talking circles, which provide group member organization, direction, and respect. So it really is a great example of that. Keep in mind that as the peer support field continues to grow, there may be more opportunities to embed peer specialists in healthcare settings than initially imagined. Here's a list of areas that may see more peer support integration in the future. With growing interest in trauma-informed and person-centered care, the peer support role can help bring the recovery perspective to clinical practice. Let's see. So I want to share a few examples of well-established peer programs already in operation that I've become familiar with over the years. Let's see, starting out, peer programs, are really structured in many different ways, as we've talked about. Some agencies are built to support this fluidity of programming. The National Alliance on Mental Illness has been providing educational programming and facilitating peer groups across the country for quite some time now. The two standard support groups include the NAMI Connection Support Group, which is specifically for peers, and the NAMI Family Support Group, which is specifically for families of peers. Now, NAMI is made up of affiliate agencies across the nation, and each affiliate has their own way of providing services. And I want to highlight NAMI Johnson County out of Iowa City in Iowa for their Our Place Peer Recovery Center, which is really neat. It was established back in 2012. Our Place provides drop-in peer support services to Johnson County residents. And they have a full monthly calendar every month with tons of activities, classes, groups, games, arts, crafts, you name it. The majority, if not all of them, are free. They often also have food there for people who are coming in, and different healthy snacks and things like that, which is just wonderful. Now, this is an entirely peer-led meeting place focused on peer support in a restorative environment of hope, support, and encouragement for recovery. Our place prides itself on being a safe, nurturing, non-judgmental community for those affected by mental illness. And I've had the pleasure to see this peer center grow even for the short span of time I was in that area. Now, this is a great example of an agency not only supporting peer support, but letting local peer interest and services drive next steps. I do want to highlight also that, as we know, COVID-19 has changed a lot of things, so peer support groups and services have been kind of pushed to the virtual format, and we'll talk a bit more about that in a second. The next kind of program I want to highlight is Photo Voice. So Photo Voice is often considered a peer-directed program. It's a recognized form of creative, community-based participatory research normally. However, it can be used instead for purely peer support programming and social change advocacy planning. It's really cool. So formal peer support specialists may facilitate this program entirely or phase out and allow the peer group to become a community-based group with informal peer support. During this program, people use cameras to capture visual representations of their communities and experiences, and later peers get together to talk about their work and share perspectives. For people working towards recovery, this is a creative way, really cool way to form peer groups and let people express themselves in new ways. Usually themes come forward and vary by the group, but adversity, personal growth, and social change are all fairly common topics. Peer groups may continue this cycle for around 3 to 4 months or longer before exhibiting their work and celebrating their experience with their community. Now, this type of programming can easily be tailored to work for different cultures if designed to be peer-led. Outcomes of photo voice programs have been found to support positive self-image, creative expression, community engagement, and increased self-determination. I had the pleasure of working to develop a peer photo voice program in a past position working with local disability community. I found that the combination of artistic expression and peer engagement made for really unique opportunity for those involved. Depending on how engaged people are in the program and if they're interested in taking it another step or a step further, there's often opportunities to use the imagery and artwork to share their stories with policymakers or others in their community, and that effectively supports self-advocacy skill building. Now, I also want to say that COVID-19 cannot take our creativity away from us. I won't let it. Photography is still possible, even during social distancing, and peer groups can still be held online. It may not be the same, but it's something. Now, this could be a creative way for people to express their feelings during this crisis. Finally, I want to highlight a program that deserves more credit than it gets, in my opinion, the Wellness Recovery Action Planning, or WRAP for short. Considered a mental health advance directive, WRAP is an incredibly useful tool to give people a voice in their healthcare decisions before crisis situations, okay? Peer support specialists can play an important role in the development of WRAPs. People receive printed booklets to fill out regarding their mental health care wishes when they are in crisis, informing others what their baseline looks like compared to their behaviors in crisis. Now, this can aid treatment teams and share what strategies towards recovery have worked in the past for the person, because there's often times that the treatment team or the providers that people see in crisis may not know what that looks like for that person, because this may be the first time they're seeing them or working with them. Now, training is available to become a certified WRAP facilitator, and some of those links are listed below. One thing is with COVID right now, people may want to revisit WRAPs to remind peers and people in recovery of their self-determined treatment plans and those effective coping strategies. Okay, so we're nearing the end of the presentation, but I want to touch on a few COVID-19 implications before we go. So there's a lot on this slide. Bear with me here. I think it's important to mention some of the things that we're seeing right now. At this point in the COVID-19 pandemic, we are seeing concerning trends for our community's mental health. Social distancing, while really necessary, is resulting in increased isolation. Okay, there also seems to be an overconsumption of social media and potentially triggering news coverage. Crisis line usage has been growing across the U.S., and the demand for mental health services has increased as well. The rising rates of financial hardships don't help either, especially for communities facing systemic inequities and impoverishment already. Additionally, the closing of major local revenue-generating businesses makes maintaining some community services difficult. Now, this is especially true for tribal communities that rely on local business revenue for public services. Before COVID-19, housing was already a major issue in the U.S., and even more so in native lands. In order to practice social distancing, safe housing is necessary, but for many it may not be possible. Also, with additional limitations on safe housing options, we are seeing across the nation domestic and child abuse risks rise. At this point, we can clearly see the inequitable impact of COVID-19 on minority groups, which further shows the importance of addressing social determinants in our communities. So, common reactions to COVID-19 are also concerning, including concerns about protection and safety, worries about regular medical care or community service disruption, feelings of social isolation, guilt, anger, and frustration, and increased distress. And we can be pretty confident that we will continue to see rises in standard, shared, and secondary trauma. Additionally, the traumatic landscape we're facing can easily trigger those with previous experience with trauma or intergenerational trauma. The increased emotional distress without healthy coping strategies can potentially lead to an increase in substance use. Also, I think we can all say that readjusting to a new routine during this crisis is sometimes difficult, especially trying to keep healthy sleeping and eating habits. How we communicate with others has changed drastically, and that includes medical and therapeutic communications that at times we really don't want to interrupt. Finally, overall mental and behavioral health condition symptoms may be intensified during this time. Essential service staff are working tirelessly to address not only COVID-19, but these other impacts and resulting community reactions. And during this time, we really need as many people as possible supporting our communities. So what does this all mean for peer support? To start, peer support specialists are considered essential workers as well. There is a surge in virtual trainings for peer support specialists to meet the expanding community mental health needs. As it was written in Forbes by Denise Brody, as of May 1st this year, a record 900 peer support specialists will have been trained in the Digital Peer Support Certification short course. So, and that's to be able to provide peer support at a distance, right? Digitally, and that link to that is there. Examples of what peer support specialists can do virtually include checking in with peers regularly to support recovery and maintain a sense of routine, facilitate individual and peer groups virtually, provide systems navigation and connection to local resources, support the use of coping strategies, making sure that coping strategies are feasible for people and their situations as well, and virtual treatment, adherence, and self-determination support. So there's a lot of links on this slide, but I'll let you all be able to check that out. And it relates to what we're saying, but rural virtual support and communication seems to have become the primary service delivery method of 2020, right? If you're looking to transition to virtual or telecommunications, check with your agency, state, tribal, or urban Indian organization regulations about telehealth alternatives to services. CMS in most states have adjusted their requirements to allow more telehealth. And here are some links to check on this information. Be sure to review your agency's HIPAA policies and cross-reference with communication platforms that you may decide to use. Now, many privacy regulations have been lessened in the US because of this new communication limitation. Either way, inform peers and people working towards recovery if any privacy capability changes. For tribal nations, Cisco meeting technology is already used by the Indian Health Service, and the Telebehavioral Health Center of Excellence has resources to support technology transitions. Finally, be sure to ask peers what distance services they are comfortable with and what is feasible. Be aware that not everyone may have internet or dedicated devices to respond virtually, especially those living in rural areas. A few methods for problem-solving virtual support barriers that I've seen have included buying prepaid expensive phones for people that can communicate with not only their peer specialists, but other service providers as well.
I can see there's one question at the end here.
Also using physical mail to routinely check to make sure people are getting their needs met while social distancing. And by getting involved in food security efforts and offering to pick up and drop off food boxes for people working towards recovery. I know there are plenty more examples out there of creative ways to provide peer support services from a distance, and I'm sure they're only going to continue to grow and improve. So we're to the end here. So I wanted to share a few more resources that I found while preparing for this presentation. And with that, does anyone have any questions? I was kind of on a roll, and so I haven't kept as good of an eye as I probably should have on the chat box. And maybe Kate and Megan, maybe you all can help me a bit with that. From my understanding, they should be considered essential. I would have to, if we're talking about kind of the federal or, just different types of guidelines like that, I'd have to dig a bit more deeper, but just from my knowledge right now,